So I'm Sharon Walmsley. I am a professor of medicine at the University of Toronto in Canada. And today I want to talk a little wee bit about how HIV impacts women and some of the successes that we've had in the management of women with HIV. As many people may be aware, more than half of the people living with HIV in the world are in fact women. And the good news is, over the past 2 to 3 decades, we've been very fortunate in developing effective therapies that have enabled women living with HIV to have more or less normal life expectancies, so that HIV has been transformed from an acute and life-threatening illness to a much more chronic and manageable condition. And we've been able to keep the infectious complications of this disease at bay. Perhaps the greatest success for women has been in our ability to treat the mother through a pregnancy and enable her to have an uninfected child. And so the probability of bringing maternal to child transmission of HIV to zero in the next few years is really a reality. But we do have ongoing challenges for women. We have many HIV medications available, but unfortunately, most of the studies that have been done primarily in men, and therefore we have to extrapolate the results of these studies to infected women. But it would appear that most of the medications that we have available now work as well in men as they do in women, but there may be differences in terms of their toxicity. And this may relate somewhat to the different body size, differences in hormones, differences in fat distribution that we see in women relative to men. There are other challenges that exist for women. One of the major problems is as they are aging with HIV, there can be other comorbidities, such as those affecting the heart, the liver, the bones. And so we need to design the most optimal treatment strategies for women in order to prevent these complications. The other issue for women is that many of them live alone and in isolation. There is still a lot of stigma associated with HIV. There's a lack of general education in the public. And so many of these women live in isolation, afraid to disclose their HIV status for fear of discrimination on their own part of that or that of their children. So we really need more public education for the understanding of this disease. And lastly of all is we're developing preventative strategies, and we need new means by which women can protect themselves from getting HIV unexpectedly from a partner who unknowingly has HIV disease. So I think the good news is that we have done very well in terms of our treatment advances, that women living with HIV can have reasonably normal life expectancy, but we still have some challenges in dealing with some of the complications of our disease.